Patrick Rardin, I know you have a book. The book is called Foundations,
Chiropractic,
Chiropractic Foundations,
your foundation
Your
of health.
Foundations of Health.
Name of the practice, Foundation of Health. I kind of tied the two together.
Right. So you're big about the foundation. So
Somehow that became the thing. Like the foundation, if you were to take like perhaps the pelvis and the spine being the foundation, and then within there in the nervous system, the foundation or the starting point of the most important part of the human being for health.
Oh, absolutely. I mean, that's what I want to talk to you exactly.
Cool.
The bones,
Yes, sir.
the internal parts of what holds the body together, which is I find fascinating. Do I know enough? Basics, strong bones equals good health, somewhat, that type of stuff. But what can you tell us more about understanding the skeleton, the bone structure? How much of it is health related? Like, can you tell from a person's, if they have strong bones or certain type of bones? Can you tell a lot about their other, health things related to their health, or what do you think?
Well, let's start by talking about let's talk about the central nervous system, which is the brain and the spinal cord. We kind of think the brain's just this way, but in reality, all the way to the tailbone. Continuous is the spinal cord from your occiput, exiting in your lumbar vertebrae and fanning out the sacrum area. So let's talk about bones. There's the quality of the bone itself, which we can handle that second. But first of all, would just be that we've got the structural alignment where the brain continuing as the spinal cord is protected by bone for protection, right? You can't go bumping your brain into things. So the bone has a protective element. But our challenge as human beings is that these bones that are protecting the spine also have to move through 6 angles of movement. Okay. And if we were to go from the top of the skull down, you've got what's called intervertebral discs or soft tissue cartilage in between the bones that have different purposes. First would be to provide some space and cushion. And that also allows from that space, the nerve can exit between the vertebrae and go out to whatever function in the body that it has to do. Okay. So when I look at bone, I look at alignment and movement first before quality of the bone itself. So in other words,
so is there everything in between the bone as well? All the what do you call it? The stuff between the bones. What's it?
Well, within a bone, you've got the
I mean, the main issues are the bones just doing this with each other, right? That's
right.
The main issue.
Well, you're showing me something where I like this demo that we've got here. Let's say that there's no disc here. Here's a vertebrae with a disc in between for shock absorption, right? So there can be a condition where there isn't any of that soft tissue in between, and the bones are there in this condition rubbing on themselves, causing quite horrific problems by that point. But just in general, and let's talk generally for a minute, when we look at all the vertebrae going down the spine, there's a general alignment, right? Things should be lined up straight. And then there's what could be called a misalignment of a spinal segment. The chiropractic terminology for that is a vertebral subluxation, which means a misaligned vertebrae that's moving incorrectly and causing irritation to the nervous system.
And this is not from birth. This is
sure it is. That's where it starts.
Oh, so
starting in the birth process, right? Because when a baby is born, it is quite large in its diameter coming through the birth canal, and that's a pretty challenging event. That's a large amount of stillborn deaths. Children that are born live in the uterus and then dead on delivery are experiencing that because of the trauma of coming through the birth canal. Okay. And also the way that they are born and the type of doctor that is doing the delivery process, the process of getting the baby to come through the spinal canal, oftentimes being grabbed, turned, twisted, pulled. A technique that they can use also are forceps, which is kind of the metal pieces that they can clamp on a head or the side of a head and a shoulder and use to pull those out.
But what are you saying that they shouldn't do that?
I'm just saying that, there's multiple ways someone survives getting into this world during the birthing process. And it's a traumatic event being born. So physically, most of us are fortunate enough to come through the vaginal canal where that pressure on the bones helps them form correctly as they go through, particularly the bones of the head, if that's come through correctly, right? So,
But most women today do C-section.
well, that's another element that we come into the discussion about what could be
Yes.
normal or not so good for a
Right,
baby,
right.
So that would be a surgical procedure in which the child never gets the opportunity to come through as it was supposed to through the mother's canal, and a surgical incision has been made, and then there's an extraction of the baby from the womb.
Mhm.
So
So many people are born that way. So you have these issues from day one.
right, yeah, misalignments start day one.
Day one.
Yes.
Interesting.
And it can either be, just as you've heard friends, family going along the ways, you've heard, sometimes well, how was the delivery process? Oh, it's quite easy. It was good. She did well. We're already on our way home. Good story, or, oh God, it was 32 hours of labor and she's been pushing and pulling. And so they had to do things to induce labor, or then they made the decision to do the C-section, right? So the baby can be turned in ways that are advantageous or not advantageous, with head down, proper direction, or then some sort of variant of that, right?
Right. I see. Interesting.
So terms that you may have heard would be breech, or rotated in a way that it's not it's not an easy process for the baby to get out. And so obviously with a lot of stress, pressure, pulling, pushing, trauma, these are where the skeleton can go through its first initial problems.
Mm-hmm.
And then
so what always, I'm just curious about the stages of life where people have big issues.
What comes next is the toddler age with the number of falls. And the last thing I am is a stat person or a research person.
Right.
I'm a practicing physician.
But you've seen it all. I mean,
yeah, but what was I just saying in terms of the birthing process is what we were just talking about?
Right.
Then we went into the toddlers, which have, I think the statistic is something like 7,000 falls between like 3 to 5 or 6 or 7. So these are the little falls and tumbles that we see.
Sure, but
don't falls right on their butt.
But don't they just recuperate out of that, out of growth, natural,
Yeah, who told you that? Which is something we assume, that if a kid falls down on his bones, everything's okay because they're a kid, right?
That's not true.
Not to me. Why would that be true to you?
Because they keep growing and changing. We in our age are kind of deteriorating, but they are, they're, no?
Well, their bones are very elastic and movable, right? They're soft compared to an old guy like me that, over time it gets hardened. So we see them absorb falls, right? And take them. But joints have movement and alignment patterns. And so although they have these falls, that's where any part of a skeleton can get out of alignment. And there's grades to all of that, from being out of alignment and not moving correctly, to falling down and extending and hyperextending something, to breaking a bone as a child, for instance. But those high number things are the ones that people take almost, I would say, for granted. Oh, Jimmy fell on his head. Oh, just Jimmy. He's 2, he's 4, he's 8. He can take it. Yeah, I'm sure he can take it. He also can't tell you about it. And we also really don't have a picture inside to know if Jimmy's okay or not. But that's a big one, is the childhood falls,
Right.
Yeah.
Interesting. So you don't think that there's a natural regenerative process that happens in the body if somebody gets hurt, especially a child?
I think that's the number one thing behind the chiropractic profession being what it is. That we have a body that's self-healing. Sure. And the body does fix itself. If we get a cut, we know we get a scab. So there's this innate healing that's going on in the body that we can recuperate. Kind of fascinating if you think about it, really. But the nervous system, being what controls that healing process, can have limits placed upon it, either by small misalignments causing nerve irritation to bigger ones where there could be genetic as well as real life problems that happen to the spine that cause interference with the body's ability to recover.
Right.
So when I look at someone, I look to where their nervous system would have pressure on it. And I would look to alleviate and take pressure off of the nervous system so that the brain is sending the proper signal down the spine and out to whatever part of the body it organizes and controls. Okay. So the ways that we look for subluxation have some clinical guidelines of things that you would follow, but the underlying process of why chiropractic works is the body's got this healing ability, and if you can take the pressure off the body part system that heals the body, the nervous system, the body then recovers and can be well. And there's a lot of there's a high gradient from almost non-noticeable or identifiable to horrific, I would say, right? Because it's like when you ask, well, doesn't everyone kind of just get better anyway just because they've had an injury? Yes and no, it depends. Right. It's a complicated question, you know.
Right. So we generally understand that the foundation of the body is the bones.
The foundation of the body is, I call that the structure of the body.
Right.
The foundation or the core of the body, I think, would be the central nervous system, which is the brain and the spinal cord. That's what houses
I see
communication to everything.
Got it.
And if we got out of this into spirituality, different elements of the human body, we would say that same central nervous system is what's taking in this data and working with it as well.
Huh. Right. So what we would do, for example, if we take, I'm thinking about health-wise in promoting and having a great system in place. Like, do you say, okay, check your full body multiple times a year, eat these kind of foods, I don't know, practice meditation, spirituality, I don't know. What would you say are the top 3 to 5 things that are so fundamental to, that people just don't notice, I guess? Because obviously you don't see your bones, right?
Let me come at it from this direction, fill in anything that I miss by answering it this way. If someone comes in to see me and they have a health condition, whether it's a pain or something with an organ system or something physiologic going on that's odd with them, the first thing I do is I put them in front of me and line them up in terms of their posture, right? So when I look at someone from their postural perspective, you can see shoulder height, hip height, rotation, deviation. When someone lines up in front of me, I'm looking at them, and that's the first indicator. I look, that shoulder's high over here. You can see more muscle in this person built here. That left hip's over here. And so you kind of get this kind of general imprint when I look at someone's posture. From there, next would come my hands. I would put my hands on those places that I see those imbalances, and I would check the musculature of there. Do I find knots in it? Do I feel things that are weird in terms of the direction in which the fibers are grabbing? Is there inflammation? Is there spasm? Is there puffiness? Is there tenderness? Does this person move or have a reaction to me putting hands in that area? So that gives me the second indicator of kind of some of the surrounding soft tissue that's around this skeletal system that we're observing its levels with, right? So from there, we go in and look at the range of motion. Okay, let's say someone's shoulders high, kind of indicating me that, you know, they could be out of alignment somewhere in here, right? So I would look at that high shoulder, put hands, I'd feel the vertebrae, I'd look at the muscle, see if there's inflammation. From there, I would then have the person go through some ranges of motion. That would show me, is the spine moving cleanly through these positions, or does it kind of get stuck or move incorrectly in certain movement patterns, indicating to me where a vertebrae could have gone out of alignment, cause nerve irritation, and cause the body to have a reaction and trying to prevent further abuse or injury to that area by tightening and protecting it off, or just moving and functioning irregularly. From there, based on the patient's history or what's presenting in front of me, comes my next option. Does this person have something that I would feel is more of a common type of misalignment or subluxation of the spine that is qualified to go into the adjustment? Or do we want to take some x-rays? Do we want to get a look inside there and say, based on the person's history, this is something we want to look at the bone quality, like you were speaking of, right? And see, hey, how do those bones look? What's going on with those bones? And how are those bones aligned that they're compromising this person's ability to feel well or be well because they're causing nervous system interference, which is either dysfunction or pain. And then my job is to identify where the source of that block would be coming from, and then remove that subluxation through chiropractic techniques so that the nervous system sends the proper message to the body, and the body can regain its feeling of being in efficiency and well-being, rather than fear, tightness, and protection and closing around an injured or misaligned area.
How much of that is psychological?
It's a great question. Vertebral subluxation, which is what chiropractors correct in people's spines, you could say generally come from three things: physical, chemical, or emotional stress, right? Physical's easy. I'm on the computer all day. I'm on the phone all day. I'm driving all day. I'm an MMA fighter. I got a karate chop in my neck. I'm a Pilates. I do this all day as a yoga instructor. These things that we do all day. There's your physical stuff. Pretty easy to see. Chemical, there's a lot in America about the stuff we're putting in our body, and the stuff that we've kind of found out about a lot of the ingredients in foods, beverages, and snacks that are coming in that have toxic effects on the body. That has an emotional component in that it has irritation to the nervous system, right? And then, or a chemical, excuse me. And then emotional is, whatever causes you stress that you're aware of consciously or subconsciously, a huge amount of the time, is a factor. It's a great question, because if I get irritated about something, for say that I have to go to the dentist today, right? I may be tight in my neck because I'm stressing on it, right? But if I got something in my neck that's been out of alignment a little bit and I'm stressed about the dentist, it's already going to tighten it up there and make me more aware of it. So the longer I've done this, the more I've learned that there doesn't ever seem to be a definable line between the emotional and the physical. If I've been irritated, there's going to be a physical component of stress in my body. If I'm physically feeling stress or discomfort in my body, it's going to have an emotional complex. Those two are working like this, not which one came first anymore.
Interesting. Can most of these, the people need to keep coming to get their bones aligned consistently, or is this like, if you do more stretching and more relaxation and breath work or whatever, you don't need to do this. Or
obviously we throw out something like what I could do for myself in terms of my own well-being. I could eat well. I could do right thinking. I could meditate. I could, be very well at psychological and emotional care, right?
Well, how far do you take it with your clients? Do you tell them like, change your bed, you're not sleeping on the right side, or how far do you take it? I'm just curious when it comes to advising them.
It's a great question, because my answer is each individual would be absolutely unique to what's going on with them. Everyone's history is their history. Some people never had a physical injury. Some people have had tens of thousands, right? You can have a 30-year-old man that's been a CEO and in an office in a suit and has mostly had psychological and postural stress and stuff on the body. And then you can have a person that's 30 that is a mixed martial art fighter that started in the gym when he was 4. There's so many different variables that happen to people. You have to take everyone individually. So I kind of start with the big stuff first. Let's look at your posture. Are you crooked or straight? And within your crookedness, let's look at this crooked part. Is this crooked part, how is it moving? How much is it influencing your life? How long has it been going on? How old are you? How do you feel about this pain? All of these things become the real answer to what care someone needs and what's appropriate for them, right?
But some things can't really be changed. If you're born with a shorter leg, what are you going to do?
Well, let's start by saying generally, let me see if I can hold that question and think about how I wanted to answer about what someone needs and what do I tell patients. Well, one, you just got to listen to them. You got to hear their story, right? Once you got a story, you got a person that's really complex and beautiful, and they've got a lot of stuff going on usually, right? People are very fascinating. So it takes a little bit of time to get someone to know someone over a little bit of time. So there's no two fixes that are the same for any two people I've ever met. Everyone's so different that way. But there's phases of care, right? And those generally would be acute pain phase, corrective phase, wellness maintenance phase. The majority of people probably come into a chiropractic office because of pain, right? I got my neck pain here, right? So now that I've got neck pain, everyone, no matter who they are and what their goal is in life, they want the pain out of there, right? So it's always, if you got pain, we got to get that out of there. Did the pain come because of, maybe a less stressful type of situation? We'll call it posture. Or did the pain come from a trauma? Okay. So there's levels to someone coming in, and an infinite level of pain or problems that someone could bring in that they are personal to them. So let's say, I'm trying to answer this correctly. If someone's never had a chiropractic checkup and they need one, correct, and they're now in pain, then we got to get pain out of the way. So that's the part about the examine identifier that I talked about. Identify where the source of the pain on the nerve is causing the problem, get that out of the way. Some people need one adjustment, some people need 1,000, depending on what's happened in the years, decades since they've been into my office. The nervous system that we talked about controls the body's ability to heal over time, right?
Right.
So when a person's pain is relieved, we have an opportunity to correct this problem that's been in there. And then we get into areas where the spine has been out of its normal area and moving in correctly. And now that the pain's down and the inflammation, and the person can actually kind of go, oh God, I feel so much better. The problem's usually in there still after the pain's been taken out of the way. And now we've got to go in and make corrections to this spine with the sequence of events, a treatment plan to get the nervous system to kind of accept the new alignment, and some exercises and stability that that person needs to do to kind of reinforce the adjustments. Okay. So that corrective plan is different for each person, right? A 10-year-old kid that fell at soccer, I'm going to get him back in a couple adjustments. A 50-year-old soccer player that's trying to get 2 or 3 more years out of his body, and it's his 4th decade of having misalignments, his correction is going to take longer than a child because the nervous system has been running that pattern that way for a long time.
So it's a very personalized and customized, approach to every client. It has to be that way, right? There's no other option.
Correct. So we've got pain and dysfunction. Let's say that we get pain and dysfunction managed, and now we're into some of the structural concerns that have been there a long time. We get those corrected. Now the body has a time period where it's used to being straight in its proper alignment, and now it's moving correctly, and the brain's going, cool, we love this, right? And then so it starts to stay there, and it likes there, right? And then once it likes being there and moving, and the muscles have all balanced from being corrected, and the spinal line up and range of motions are there, now we start to see, okay, how long is it before someone needs another checkup? Some people are going, like we said, back to the office. Some people are going back to the gym. That person going back to the office could have, a major marketing problem. Shit, the world blew up. The nervous system goes, I know what to do with stress, and it protects it, right? Or the guy that's an MMA fighter, got neck back, it's coming in there. Someone could get him in a headlock, and now these problems reverse themselves. So the body's always changing. Every moment the body is in some sort of dynamic situation of evolving, right? And with health, we either see it's going up or it's going down.
Is there some kind of I'm just curious, is there some kind of a psychological mental work that people can do? They know some moments like that come along and kind of like prep themselves so they don't tense up or create. Is there anything like that out there? Do you know? Are you familiar?
It almost sounds like the secret to life, doesn't it?
But you know what I mean? You're not going to solve all the problems in life, but at least you know how to manage it and say, you know what? I know this will happen. I know this happens. And
sure.
Plus, you know yourself. So you're like, it usually happens to me in these situations.
Sure. Right on.
So
yeah,
I'll prep for that.
Sure. So if I was to get to that part of the conversation about, okay, I know I'm going to go into my work environment, which causes a lot of these stressors. What can I do about it to empower myself, correct? Let's say that we already started with the exam, though. They didn't have any specifics to where this misalignment, if the problem that's challenging the person's health is a vertebral subluxation causing nerve interference, then we correct that. And in the process of going through the correction, we're giving a lot of awareness to the patient, right? They're getting a chance to tell me about their history, and I'm going to give them feedback. So we're already empowering someone with some information as I'm working through their history about how they got to this particular place. Once we get there, like we talked about, there's physical exam, touching, range of motion, more identification comes up. Does it bother you here? Okay, when you're at work and you reach that way, is that yeah, we go over some of the dynamics during the exam. Then we take some x-rays and we look at this issue. And so now the person has a thing in their head. They may take a picture of the phone, or I email them their x-rays if they like, and that person, now they can look at them anytime they want to. More knowledge is power, right? So now I'm going back to the office, and I know that, when Jan comes in, my stress is going to go through the roof. At least now when we're coming through, we know what's going on in the neck. Before, all we knew is the stressor came into the room, and that makes me tense and my neck goes out. They didn't know anything about underneath what's going on. We've identified where that is. We've talked about it, right? And now that person is empowered with understanding this a little bit better. And now we can move, as I'm physically taking this patient out of physical pain and getting normal function, now we can work on mental, emotional, spiritual type of endeavors. So I can say, all right, well, when you come in to work that we're going to be dealing with this, and we might talk about breath, or we might talk about, taking some time to be prepared for that and to be working it in. The purpose of chiropractic wouldn't be to do some, psychological neuro imposition on how they should think or be, although that occurs to a certain extent by guiding someone. But more than anything, when you take pressure off the nervous system and the nervous system's not under stress from dysfunction, someone's ability to handle stress and well-being, your resistance goes up.
Yeah.
So that's the number one thing going on with chiropractic is, let's say that it's a stressful situation for me to do a podcast. Okay. So, I'm kind of tense about it. So, by having my neck checked and if I came into this interview out of alignment in my neck, then my ability to handle some of my fear and stress is diminished, right? But if I don't have pain in my body and there isn't nervous system interference because we've been corrected, now you've got the best opportunity to handle the world and all of your stressors. It's kind of like, I guess the thing is, once you're having a bad day and you get down, it's tougher to manage anything and get back up, right?
So almost with every guest, I always ask this one question because the times we're living in is the AI and robotics stage. And I'm curious about how this is going to affect. Have you ever thought about it? How it's going to affect your industry at all?
Yes, I have. Just
I would love to hear where it's going to impact. Does it affect your personal job or just the industry itself? How are you going to pivot, not pivot? Where do you think, because it's kind of challenges. What does humanity mean? What does it mean to be human? Type of thing, So give us your thoughts.
Yeah, I was maybe texting you at the dentist, and, on Google, it popped up, Bill Gates talks about such and such about AI in the future.
Right.
And of course, forecasting that most jobs, including doctors, lawyers, they're all going to be handled by AI, right, or quote unquote, free knowledge is now what they're suggesting. Yeah, free. Prison your soul, but you'll be free. Yeah. So anyway, I just, like I always do around this stuff, am grateful that, in my opinion, hopefully chiropractic is, it's the art of touching and laying hands on the body. As the whole world shifted into telemedicine, I didn't have to. I always get to sit with the patient face to face, talk to a patient face to face, touch a person, heal them with my hands. I don't think that there can be true healthcare without face to face and that kind of connection. So for me, chiropractic doesn't exist with AI. AI can be used in a chiropractic office for notes,
Let me throw it at you, okay?
Yeah,
Let's because as you were talking for the first half, I was like, okay, you know, he does this. You talked about your procedure, right? Your structure of your approach, and I'm like, okay, he's right. The hands and the feel of what he has, the creativity and all that, you know, that's just him as a person. Which parts are not? That's what I was kind of thinking. Which parts are
sure.
just like can be just, you know, automated?
I'd never pay for it, but you could get an AI X-ray machine, perhaps. That you just send a person into a room and somehow it knew how to guide them through taking X-rays. That saved me a bunch of time.
Right. But if, for example, you know how they have Neuralink right now, right? You have the Neuralink with and then they're sending AI bots inside the body, nanotechnology, which can identify anything and tell you what it is. So maybe touch isn't necessary.
Well, to me, that all sounds like, the stuff that can be used in terms of identification and diagnosis. And then I know with medicine, then which also you don't need to touch a person with medicine. I guess you could mail them their drugs. I don't know how you can mail them a surgery if they want to cut somebody. But in terms of chiropractic, the hands are what is necessary to get all of that information in. I'm not sure where AI goes, but if we were to take it to the next step, which is, couldn't a person lay on a table and a robot could come over and do all these things? I think someone could make that happen this afternoon. You know what I mean? Would that be my spine or someone that I would care about? No, because I just don't think that we can ever create artificial intelligence that would be able to have the power to examine and heal the body in chiropractic from the form that we were made by the Lord to create us in the form of a human being. I don't think you.
Well, I'm trying to.
To me, I don't know how to fathom something. Although I know this is coming quickly.
Well, I'm trying to identify where that human element is. So if I give you the scenario, they send in some nanobots that scans your whole body, looks from the inside out, they can tell. Okay. They send that information to an AI program on your phone. On the phone, that transfers to a robot that comes along or medicine to tell you exactly what you need to be doing. So I'm trying to figure out, okay, where does Patrick come in? What part of his that the robot can never do? And I'm thinking it's the human part. But what is that human part, right? What part is it, right?
Well, it's the my job calls on the total potentiality of my entire human existence. It's not compartmentalized into one aspect.
You're right. It's not. That's what they're creating agents, right? That's what I had an AI specialist here, and he's like, "We have an agent for everything." Like, what do you mean by that? Mm-hmm. He goes, "If they're an accountant firm, okay, we have somebody who does the invoicing, so an agent that does this. That for the invoicing department, there's 50 agents that control this one thing. Right. So they have agents. Literally, it's like a matrix, right? They're creating agents, AI agents that are." This agent is in charge of moving it this way. This guy in charge of moving it this way. 50,000 agents to do one thing, right?
Yeah, so maybe two terms would be static versus dynamic. In this idea of robot chiropractic, just the listings count. Whatever the bot says, there was, you swallow the bot, and the best I think a bot could ever do in terms of vertebral subluxation, which is so multi-complex to all parts of a human being to be effective, and all that's so important to analyze, that it could tell you perhaps is something right, is something left. Where could the machine then put the impulse to correct the right or the left? But chiropractic's dynamic. It's not right or left. If there's a right or left, there's a right or left above and below it. There's soft tissue. There's a nervous system. It's much more,
of course,
to the whole thing. So,
of course,
I don't, and I think it's a little different. Let's say that, the bot picked up, I have an ulcer in my stomach. So we take then the medicine the other bot comes and gives you the pill, and it knows where to go to give you the proper, medicine to help heal that. Point A to point B. Chiropractic isn't necessarily point A to point B. So it's different that way. And I'm telling you it's different because I'm telling you it's the thing much different in that you're asking me I think the thing that we're trying to get is you can't have chiropractic in a human connection without two human beings. Chiropractic is not static, and it's not something that's only about one or two things that something could be picked up on. And
so you're saying you need to be wearing many hats in this profession to be great at it. Is that what you're saying?
To correctly serve a person with a license of doctor of chiropractic. I'll say it that way. Yeah. Right. To do an honest, good job. I can see it destroying my profession now that we're talking about it, of course. Right? Assembly line, right? Assembly line of machines just punching on vertebrae. Yeah. Great. You don't even need a history.
I mean, it could be just way beyond that. I mean, it could be just preventive medicine is so advanced that honestly, they're not going to have, to fix something. First of all, the majority of the population won't have those problems because they're able to, preventive medicine is so advanced. Number one.
I don't think it is, and I don't believe any of that. No. Say that again as simply as you said about how the idea of where this would go is that they're so good with AI that we're going to genetically predispose you to know what your conditions are and give you magic pills and toxic chemicals that go through your body and clean it all up and make you a perfect human being. That sounds like an Orwell novel to me that's gone bad again. That does not sound realistic. I know people love that, and I know people love technology, sure. And I know people want easy answers and want to say, well, this is that. But I can tell you that something as dynamic as human physiology cannot be compartmentalized into bots and procedures.
Sure. I'm just pushing the envelope here. Mm-hmm. Now, does it mean that it's going to get to that level of whatever? It's like, not now, probably not.
It's already further than I could ever imagine. So you've got a good point in stretching it as far as we could.
And all I'm trying to see is the human element in this whole thing. That's all I'm trying to see. Where is it? How much of the job description is going to be, like, let's say you, for example, there's specific parts of the job that you love. And let's say those specific parts that you love are the ones that the AI is going to take over. So what part of the job lives for you?
It would be the opposite of my reality then, right? So I would say that technology has already replaced the part of my job that I hated, which is the notes. Okay? Yeah. So, and I've already been in offices that have gone beyond electronic note keeping, and now they use artificial intelligence. So like literally you go into the room and you're talking with the doctor and stuff like this, and it's recording everything and formatting and putting it on your page for you, much like talking into a microphone would do.
Doesn't that sound great?
No, because
Why?
I looked at my report and AI got it wrong. And there were things I said incorrectly, and there were breaks in the connection. But that's not the important part of what we wanted to talk about. It was, get me back to the human part of this. What is it that I do that's non-producible? That's what we were talking about, right?
Yes.
So I did it old school. I am old school if you haven't learned yet. So, the number one thing that, let's talk technology before AI, that tech did for me was it gave you a website and it gave you something called reviews. Now people could look at doctors and they could say, hey, wow, maybe I should go see that guy. He's got great reviews. That's probably the thing that's helped me the most in business is people being able to talk about me, because most doctors like referrals because you start working with people and their circle hears about this and they come in. It expands the circle for people to find people easier that may work with them better. You can list the things that you do and get more narrow and more specific. In terms of AI, I guess you would have a bigger ability to, God, I don't know. I'm sorry for blowing this.
No. What would you streamline for your business? How would you, what? I could do my job better if AI helped me in this area. What would that be?
I think I'm thinking about what I'm talking about right now, which is instead of keying in my notes, I probably would speak them into the software, and it would do it in a way that worked for me, instead of a way that if I did it now, I would have to go back through the notes, clean those up, make sure I got it right. So If the only way I see AI helping me would be to help with the notes, the communication between the outside world and my office, for instance, scheduling, that kind of stuff,
Which is right here already.
Right. And so I did that after many years of doing it the old school. And I can tell you that the electronic notes has been a really good improvement. Right. So to me, it would be the business things, not the chiropractic that can be replaced. My first thing when he answered me that was, what's a technical thing that just does require pushing a button? That's an x-ray. An x-ray lines you up, takes your weight, measurements, age, puts it all in there, and then it technologically takes a picture, and that goes into technology. I guess I don't need someone to do that, but you have to tell that AI what areas to do and which ones to x-ray or identify. But other than that, I think I'm going to stick with my guns. I don't really see any place for AI in a real doctor of chiropractic's office, one that uses their hands to physically touch a person and heal their body. I think that you could have neurological technology that would give input into AI about that. But the reason I have trouble answering your question is it's about what does it mean to be a human being? Hey man, I don't know. Every time it's going to rain, my toe gets numb. Or when I'm around someone that really isn't good for me, I get a weird feeling in my gut. Or my wife's got this great instinct about. These are all these things that are not measurable. They're things that we have as human beings that give us signals and give us information about from us. So I would imagine the majority of stuff that comes to me is subconscious, and it's been part of me interacting as a human being since I was born. And then for 30 years as a chiropractor, this technology is getting data and working with it every time. And then I have I suppose the crux is how diverse can a machine be to the ultimate diversity of a human brain and human consciousness, which I don't really even think we have the capability of understanding how much we're capable of and what we do still to this point. If anything, we've undervalued that and overvalued Bill Gates and technology and AI, which to me is a very unattractive world and a very unattractive way to think about healthcare personally.
I agree.
I personally wouldn't, and personally do not interact with doctors or people that want to telemed me. I still live in a world where if you're someone that's important to me, I'm going to be in front of you. So there's philosophical things that hit me way before we get to, how could robot X know as much as Dr. Y when he observes a patient? As much as they could be matched together with listings and technical things that kind of look the same, I know that whatever system the human body is using would never be the same system that can be created from technology.
No, it cannot be the same system, but it does accumulate information from human experience. That's where it's getting information from us. So, and it's not only taking it from one individual, a world of history, right, of information that's there.
Okay.
And at the same time, it's still studying in real time all of the things you're doing.
True.
So it's it's massive. But yes, you're right. It's not made of flesh and blood. It's not. It's not going to be. There's that. It's a different thing. I get it. Listen, I don't have it figured out. That's why.
We could spend a few probably casts just right here. I get it.
Absolutely.
I'm wrestling with it as we talk because you know what? One problem is I don't know anything about AI or technology. So how can I answer how it would be better or different or similar to me and my brain, which most of the time I think is running on subconscious data. And then same data, I continue to try and get better at what I do every day. That's been something I started a long time ago. And it's something that's paid off really well for me is that we got our good days and our bad days. But if I'm trying to learn and improve every day, this expansion of what a doctor could be to a person, it becomes less identifiable and dynamic, not more identifiable to compare it to AI, in my opinion. Now I'm starting to really stretch my own idea myself. And what else am I using?
Yeah, that is actually fascinating. A fascinating thing to see when the cup overflows. You don't have a choice, but you kind of start studying other things to improve your practice, improve what you're doing, right?
Sure.
So you probably started. When did you start?
In San Diego in 1997.
1997. So I mean, I'm assuming you studied here.
Yeah. I graduated in 97 from Logan College of Chiropractic in St. Louis, drove out here and started right away in Mission Valley.
Wow.
Yeah, 28 years ago.
You've seen the city change.
Yeah.
Yeah. So you probably started one way, and then you've started adding all of these extra skills and
With chiropractic, not extra skills.
no, I don't mean like skills in this.
More experience, more wisdom, more awareness, more repetition, more understanding, more humbleness, more pain, more joy, more highs, more lows, miracle patients that didn't get better. I mean, it's the gamut. They call it the trenches when you're in private practice dealing with patients in chiropractic, hands-on all day, every day. It's got everything you could ever imagine, including in one visit. If there's anything that I think couldn't be categorized and accurately called chiropractic, it would be that something other than a human being tried to pull off something so dynamic.
It's interesting. I'm wondering about, each profession has their own issues, like a hairstylist, that certain parts of their bodies
For sure.
hurt. I mean, what is yours?
Wrist, elbows, low back, primarily.
Uh-huh.
Yeah.
I mean, you look like you train a lot.
Have to. Yeah.
You have to.
Yeah. So I have continued to do a physical job for longer than most people do a job of my physicality. My way to continue to do that has been to be as into keeping my body as well and healthy as I can so that I can do it without limits. Yeah.
So you're pretty health conscious, I'm assuming, since you're.
Yeah.
What do you think? What do you feel about that in general? And should the doctors in general practice what they preach?
Yeah.
What do you feel about that?
I think everyone should practice what they preach.
Right.
I guess any doctor hopefully would be in alignment with what their principles are and a belief that their job is to, set themselves aside and be present for someone in their shoes, unaccounted to any history or struggles or ideas you may have that could be different. Your job is to get in the shoes of this person and really just be present for them as much as possible. That's why, like when we started the interview, I told you in terms of when asking about these things that we're trying to get to quickly, you can't discount the history. You couldn't discount this initial moment when I meet someone is just as important as the sixth x-ray or the adjustment at the end of the day, because this is a multi-dynamic person that will have physical, chemical, and emotional conditions. What percent? That's a great question going back to what we said. Some things do have a little bit more of one of the components to them, maybe more mental stress than physical or vice versa. So if you're not really sitting there to hear that and feel that, if I'm a machine listening to data and taking that in, then it's data. If I'm a human being, I can look at your eye. Is someone's twitching? When I ask them a question, did they look away? When we talked about certain things, did they react and get mad? Or did they just not talk to me? I just don't know how. That's why it's a funny thing, because I don't understand AI. But these are things that I can sit and tell you. But when if you were my patient and sat down, I wouldn't go, huh, okay. There he is. I'm going to say, oh, he took a breath. He looks relaxed. And it's data that's coming in. You take a whole person in and it's all relevant. But what they say, how they feel, how they behave, what they think, it's really just as important in my profession.
What made you write the book?
To be able to communicate a very misunderstood and hard to understand profession so that my patients could read that.
Was it for them or for you?
It was for them. Yeah.
Because you know why I say that? Like some people like myself, for example, if I write a book, it's more for me to kind of review my thoughts and on a solid thing that I've worked on versus teaching anybody else.
Yeah, no, I've never sold my book. I never put it out on Amazon to sell it or anything because I get to answer this question that it is specifically for the patient to understand chiropractic better and to understand who I am and what I'm doing in the process of working with them as a chiropractor. I start the book with my story. What happened to me, how I became a chiropractor, and why I became a chiropractor. And then I list a lot of the basic things that are important that people should know about chiropractic in general that they often don't get. So in this case, it was a burden for me. It took me many years. I wrote stuff for many years. But to do the stuff, to get it on paper, to get it published, to go through all the back and forth drama with that, you can save it, man.
Oh, yeah.
I didn't want to do any of it. And so, and I guess I say that not like the goal was never to get a book so that I could get a bestseller and get a return for me. I guess the return that I get for me is I got to speak my truth about who I am, what I believe chiropractic to be. And I have someone that if anyone in my office said, Doc, can you give me more information to take home so I can understand better what we're doing? I have something very empowering to
That's great. That's great. I like that a lot. Thank you, man.
Yeah, my pleasure.
That was great. A great conversation for sure. Should have you back.
Yeah, let's do it.